out healthy recipes of food for thought, showing next on AHTV.
First up, and you cook it just a little bit longer so that the milk solids in it get nice and toasted, and it brings this really lovely nutty flavor to everything. I love this stuff, and it is wonderful on popcorn.
Hello, welcome. Good evening and welcome to Africa Health Television on TSTV. This is Clear on Health. We've been discussing in the past few days on your habits and health. How do the habits you exhibit or use or the way you live your life, how does it affect your health? We've spoken on a few things, your eating habits, sleeping habits, and so on. And I think it's interesting to know because these are the lowest hanging fruits you can change so that you live a better, a healthier life. Again, we want your participation. And so as we continue to talk about habits, a number will come on the screen. The number is 0907 111 5342. So you can ask your question for clarification or you can be part of it by contributing. Today we're going to continue with this discussion with very interesting habits and how they affect health. Again, I have the same guests I've been having. I'm privileged to have Dr. Ajuon, Olusegun Ajuon. You're welcome, sir.
Thank you very much.
And Dr. Fumi Elusoji, you're welcome, man.
Thank you, sir.
They will be handling these topics on habits, and I think I will start, today we will start with a simple one, personal hygiene. Now, you take it for granted, but these things are not supposed to be for granted. You're supposed to be serious about it, and it's going to keep you very healthy. So, Dr. Ajuon, you will help us. How do habits around personal hygiene affect our health generally?
Thank you very much again for having me. Personal hygiene, as the word says, personal. That is what you do by yourself.
Yes.
I think the simplest or the one that comes to mind immediately is our hands.
Okay.
Is it necessary to wash hands? At the beginning of the program, we talked about some immunity. The skin happens to be probably the most important or the most resilient immunity that God gave us. So as long as the skin is not broken, many things are kept outside. It can, even if you take your hand inside germs, as long as your skin is not broken, they may stay there.
Yes.
That's why currently we are saying you are advised, please avoid using your hand to touch your eyes or touch your nose or touch your mouth, because these are openings. You can pass those germs into the body. But if they remain in your hands, they can do nothing, because there is immunity there. But maybe you have a scratch. Your hand brushed the wall without your knowing, because it didn't bleed, but there is a breach. Then bacteria that you carry with your hand can cause infection of the skin. So in simple terms, if you just use water and soap, you will kill off many of these agents, especially viruses and even bacteria. Soap and water will clean them up. So if one does this regularly, either you shook somebody because you don't know where he or she has put her hand, his or her hand. So you think you've greeted, but maybe you've collected a few bacteria, a few germs. As soon as you have the opportunity, just use water and soap to wash it off.
Okay.
Right. Many of these bacteria, especially viruses, they need the help of a human cell to be able to grow. So you wonder, how can ordinary water kill virus that we're looking for drugs to kill? So it is a healthy thing to make it a habit that as soon as you have the opportunity, maybe you've gone out, you come back, wash your hand and use water, just water and soap, preferably running water. But as long as you get somebody to pour water, it becomes running water. So that is one thing. Then another thing is you take your bath. One can say, oh, of course it is not only that it is people can sit near you without perceiving bad odor. The fact that you've also touched or you've sat in places where you have picked up things, even from your clothes that you have not worn for a long time.
Yes.
There are many things that might be hanging. So it is safe to just ensure that at least once in a day you take your bath.
Okay.
If depending on your work, if you have to sweat, then you may need to take your bath more than one time in a day. Then one of the few things too is you wake up in the morning and you say you wash your face because there are secretions in the eyes. You also brush your mouth because some of the food particles of the meals that you ate the day before or during the day, when you are sleeping, some are still in the mouth. Bacteria in the mouth, and there are many, there are safe bacteria in the mouth. They break them down and they release some bad odor. So you speak to somebody and people are covering their nose. So just simple, if before the toothbrush came, people were using chewing stick. So even if it is chewing stick, use it to clear whatever debris is in the mouth and use water to rinse it. So this is important too. Yes. And another thing that you can say is personal is you finish using maybe eating corn. Yes. You need to throw the cob away. Yes. Do it in proper places where it can be maybe burnt or something. Because if you just throw it anywhere outside, it also grows. It grows fungus, grows virus, grows bacteria. And if children now come around and playing with it, of course they get it, and children cannot wash their hands. So you put it in their mouth and cause it. So you now have cholera problem, and so the habit of taking care of your personal hygiene is a lot of it gives you a long way in preventing diseases.
Yes, sir, but on the other end, there are times when some people overdo these things. Okay. Those with what the psychiatrists say, compulsive, obsessive.
Yes.
And then, well, that is extreme.
That is.
But what about other hygiene, like women who have to dip their hand into themselves to wash every day? How useful is that?
Well, it has been found that I think we call it douche.
Douching.
It's not very safe. It's not very safe, and it has also been shown. There are studies that have looked at, does it have any benefit? The risk associated with it outweighs the benefit. So it's not necessary. Some will say, oh, odor. Odor, you know, it is so that part of the body is allowed to have a peculiar odor to you. But once you take just what ordinary taking of your bath is enough. But to now dip your hand inside with vinegar and things like that, it is
different kind of
chemical. Is not
It
safe.
could be
It's been
injurious.
found that some will say, oh, it will prevent pregnancy. It will prevent. It has been shown to do the opposite. So I will not recommend.
So there's no need. So thank you very much. We're okay with that for now on personal hygiene, because there are so many things on personal
But
hygiene.
maybe we should wash our clothes too. Don't forget.
Clothing should be washed, especially in weather that people sweat. A lot, like ours. I would like Dr. Elusoji to answer the one on women. The use of beauty products, bleaching cream, glutathione drips, vitamin C drip. For those who do these things, what are the dangers that they face?
Okay, thank you, sir. So for bleaching cream and, you know, any product you put on your skin to make it glow, some will tell you it's not bleaching, it's just making the skin look brighter, you look younger. The problem is the skin is not nylon, like it's permeable. Certain things can pass through the skin, gets into vessels, and then ultimately is, you know, transferred to the kidneys and then filtered out. The problem with using different products is you don't know the constituents of that product. Even when they tell you it is, some will tell you, oh, it's all natural. Everything here is natural, so it's supposed to be safe. There's a rule I've heard somewhere: if you can't eat something that you put on your skin, then don't use it.
Wow.
I heard it somewhere, and it's so profound. And you know, people are discovering more and more things these days. We are having all sorts of cancers. We are not sure where it's coming from. We are saying it's a mutation. While we are still waiting for finding how they actually start off, it's good to do the safe thing you can do for your skin. So it's good to look nice, it's good to look beautiful, but be mindful of what you're rubbing on your skin. These things can, you know, go into the blood vessels and ultimately filtered by the kidney, and then some of them have a bad effect on the cells of the kidney and, you know, start causing disease or start causing, even if they tell you it's herbal, the fact that it works for A and it made her look younger does not mean you won't react badly to it. So use something that is seemingly safe.
Now, on a lighter note, what's the difference between toning and bleaching? Is one a euphemism for the other? Some say no, it's a toning cream.
Well,
it's not bleaching.
From general word on the streets,
yes,
bleaching means you are maybe as dark as I am or darker than I am, and then you become light-skinned.
Okay.
Like we look at your old pictures in secondary school, and you know when you were younger, and there's a lot of difference. Then toning for some people means you just make the skin look brighter. Like you look, you're not yellow, you're not dark, you just look bright, or
you just glow. There is small difference.
Yeah, so they put
toning, there is no chemical involved.
Okay.
That's like if it is mango leaf mixed with banana leaf and this, and okay. But if you have to put chemical, like you mentioned glutathione, you mentioned there is mercury, there is those are heavy metals. They damage the kidneys. So if it is toning, you check what is the content. You are not seeing any chemical there.
Okay.
You can.
I think this is very important to our female viewers and men who also bleach. Probably look at the chemicals and be sure there are no things that can damage your major organs. Let's continue with the beauty products. What about those who take glutathione drip? So they can look younger and younger.
Age is something that is inevitable. Aging is inevitable. We would all age, no matter how much vitamin C drips or glutathione drips you take to look nice or look fresher. You would still. It's going to be a process that you eventually go through. Now, there's nothing. The problem with taking glutathione drips is that what's the effect? What's the long-term effect of it? It's not going to last beyond. It's going to be taken out of the system, filter that out. So, what is the long-term effect of taking this glutathione drip?
Yes.
Does it maintain the beauty for, a year or 1 month? I feel like I feel like it's a way beauty, parlors sell their product. I feel like that particular substance can be gotten from certain things that we eat, and made by certain cells in the body. So taking a drip to give you it in large dose, and then you feel fine and beautiful with yourself for like 2-3 days. You feel you are glowing, and I'm not sure how long the effect of the drip lasts. And then subsequently you have to go back and take another one again. So you are servicing the...
Yeah, but you feel good that you're looking...
Well, aging is going to go. Why don't we switch to something more natural, something more sustainable? You would age quite all right, eat healthy, get the kind of fruits that, work well for you.
Yeah.
Research on healthy foods that would give you that natural glow. Maintain eating them as regularly as you can, and then see its effects on your body instead of going through that means, because it's expensive.
Yes.
It's quite expensive. There's the economic side of it. And how long are you going to keep doing that?
Yes. Well,
it's also been shown that glutathione may be a cause, or it is toxic to babies. So pregnant women are warned.
Wow.
Okay.
Yeah, because it's been said to be probably teratogenic. That's glutathione.
Yeah. So now that we are talking glutathione, I think it's logical to dovetail into other habits like the taking of supplements.
Okay.
They claim so many things that I wonder, do you still call it supplement? You say it cures this, cures that, and you still say it's supplement? What is your opinion on taking of supplements?
Well, as a medical practitioner, I get asked this question by my patients.
Yes.
Doctor, this one, what is the meaning of supplement? Something that you are adding to something. So it is actually not, it is not a treatment.
Okay.
It is meant to be a supplement. If you can afford it, I have no qualms, provided you don't react to it. But some of them are so costly for the benefits.
Yeah.
They have very little benefits and so costly.
Yeah.
Cellgivity, if you hear how much they tell me they buy Cellgivity, and there's really not much that has been proven.
So, but let's go back to a bit of the science. Some people say that, okay, it makes glutathione come up and other things.
No, the truth...
I think I would like you to answer this because it's something that is very important. Okay. Do you rave the body and cause it to work very hard? But we will answer this question after the break because this is very important for us. on Africa Health Television on TSTV. This program is Clear Online. We've been talking about habits and how they affect your health. Before we took a break, we were just talking about habits that have to do with the taking of supplements. Some people with supplement claim that because with time, with aging, you are losing certain things, and how your body produces such certain things is no longer going at that rate. You need to take those supplements so as to maintain that. And I was about to ask that it's like driving a car. If you need to put your leg on the accelerator for long, what is going to happen?
Well, maybe that is a hard way as an example.
Yes.
But the question is there any benefit to supplement? The answer is maybe some.
Okay.
Maybe some. And who should take supplement? Maybe old people.
Okay.
Yes, because if you eat your carrot, eat your tomato, eat your garden egg and nuts,
Yeah.
your system is able to get the benefit out of it if you are young.
Yeah.
But with age, the system is less efficient. So what you will normally get if you are at 40,
So even if you are eating
the correct
at old age, the correct meal, the system is ineffective to collect what it needs
everything.
to collect.
So a little, a concentrated supplement will then help.
Okay.
But there is no need for me to now say I want a supplement that will enhance my performance.
Yeah.
At what age? And okay, let us assume that my performance can improve. What of my heart? Can my heart cope with such? So if you overdrive the system, you can kill it. Can kill the system.
Okay.
So
Because I believe that if one organ, you are forcing it to work, I believe that they work in tandem with other organs.
Yes.
And so they can overdrive the other organs as well.
Yes.
And if that is affecting only one organ, it can overdrive
the others.
the others
Yes.
as well.
So whatever it is, please, moderation.
Okay.
Moderation.
Okay, I think that's a very good word all the time.
Moderation.
Maybe we will take one more topic.
Okay.
We will take sexual habits. There are different habits that people have. The common one we know is, having multiple sexual partners, and then it's people who use aphrodisiacs, and people who use performance enhancers, energy drinks, maybe chemicals like Viagra, and so on. Some women put something in the vagina to tighten it, and so on and so forth. We will want you to discuss how these practices and more affect the health of the individual.
Well, on a serious note, the Almighty God gave us ability, this sexual ability, for good reasons.
Okay.
It's, because why you are, if it is a safe, that's you are doing it with your wife, it is healthy. Because there are several hormones, feel good hormones, that helps all the system. So it's a good thing, but we must be careful. Because of stories you hear, of videos on social media that say, oh, you can last forever if you take this. If you, like we said the other time, if you overdrive a system, you are likely to kill it faster. So there is no need for enhancing. But we've had situations where somebody is on treatment, and the treatment side effect causes maybe loss of libido or erectile dysfunction. Okay, we are a few things that we are trying, like some just ordinary vitamin E has been shown to help. You try that, and of course making sure there is no other disease. But if it is because of drug that we are using to treat hypertension that is causing this, I mean, hypertension it will kill faster than loss of libido. So there are times when we just say, you know what, just accept. So there is no need to take any enhancer. There is no need. But also there are specialists, because when I treat people with diabetes, diabetes can also be a cause of sexual dysfunction. I send some of them to urologists if there is any other thing, because there are a few things that can be tried, but please don't try the one at home. There are specialists in the hospital that can help. And there are situations where we say, you know what, let's just accept what is happening.
No, you know, someone will not walk into the hospital and say, I feel I'm no longer able to have enough erection. They do, but there has to be some discussion.
Oh, yes.
It's not something that can come out easily. So it's easier to go on what has been advertised, and so the energy drinks, the aphrodisiacs, and so on.
That is why I'm happy with your program.
Yes.
That let us make this thing clear on health.
Yes.
Get a doctor or your health provider to a stage that you can be open.
Yes.
To the doctor should also listen.
Yes.
And be open to hear, to develop confidence in that patients can develop confidence in there, and be plain. Look, I'm having issues, I'm no longer madam is complaining.
Yes.
The doctor should understand what a man is saying, that my wife is complaining. And then you look for, why should that be? So, should we use aphrodisiac? Well, as long as you are not trying to kill, you are careful not to kill any other thing.
Yeah.
Because a few things are, oh, somebody came and said, if he eats the fruit of sogele moringa, or the wife usually will thank him for the night after. So if it is a fruit, okay, I mean, I have no qualms about it. But what of Viagra? Is Viagra safe? Of course, Viagra has been shown to be beneficial. But also, if you want to start it, don't go and buy it yourself. Let it be that your doctor who is looking after you knows the condition of your heart, knows your blood pressure, before, and the dose to start you on, before you kill yourself. Because we've had a few important people that just go ahead and waste themselves.
Yes, but for the benefit of viewers, what exactly is the cause of death when you discover that people use those enhancers or aphrodisiacs? Is it the Nigerian magun, or is it, why do they die?
Well, most of the time,
yes.
It has to do with the heart.
Okay.
It has to do with the heart, because so much hormone is poured out, so much energy that the heart can no longer cope, and there have been, most of the time, there have been underlying problems that are not solved or detected.
Yes.
So most of the death is cardiovascular. Most of the death. Somebody was saying, can sex cause bleeding, stroke? Well, it has been, it is possible. So if you have maybe an aneurysm or some abnormality of the blood vessels in the brain, too much excitement can actually lead to a bursting of the
the blood pressure will rise.
The blood pressure rises,
yes.
And then the aneurysm, the abnormal bulging of the blood vessel will burst.
Okay.
And that can cause a lot of problem, either a stroke or even a sudden death.
Okay.
So that's the main, usually when you have a fatality from aphrodisiac or, it is usually cardiovascular.
Okay, but what about women who put things in their private parts to try to tighten it? Sometimes it's herbs, sometimes it's medication, sometimes some kind of fluid or something.
Well, again, thank God I'm not a woman in this matter, but there is no, like the doctor said the other time,
Yes.
aging will come, and if you have not overused it, it won't be too loose. And if it is, if I have used my wife so much that it's loose, I should accept it. She should accept me too. I'm not complaining. So it's a bad habit, I would say. I think I read of somebody that said it was supernaturally, she became a virgin again, supernaturally.
Okay.
Yeah, but the point is, there is no need for you to say you are using any chemical that you are not sure, that is even like you are sure is likely to have a side effect in your body. It is probably not wise for whatever reason, maybe to get somebody, and if you get a man because she's tight, and you marry, eventually the tightness will become not. Will you go and put the thing there? So my advice would be, such habits are dangerous.
Yes.
There is no need for a woman to say you are putting something. If it's an exercise, because there are exercises, the Kegel exercise they call it, where you can tighten the groin. Those are safe because you are just teaching your body parts, your muscles, to be able to tone up a little bit more. Those are, but if you have to put chemicals, I would not advise it.
Okay, I think we're hearing very well. Those who have to take something or put something is dangerous to health. Please, I want to remind you of the number 0907 111 5342. Try to call us so that you can express your views or ask questions to be clarified concerning the things we are talking about. We would like Dr. Elusoji. Let's talk about something. Well, the last topic also affected women, a topic that affects women more than men. When people wear uncomfortable dressing or footwears or girdle or whatever, so they can look very smart, how does it affect their health?
Well, for wearing uncomfortable shoes or, majorly shoes, dressing is a bit of a subjective thing. Everybody knows why they dress in a particular way. But I'm of the opinion that it's good to wear something you are comfortable with. So if wearing a very short dress is something you're comfortable with and you would look presentable to people around you and you think you're cool with it, then it's up to you. But for wearing shoes or uncomfortable shoes, the problem with it is the fact that the body is a system. Everything works together. You have vessels, terminal vessels in the legs, you have terminal vessels in the hands, and then you have everything. In fact, the vessels there are pulled by gravity. So you have everything flowing back to the heart. You're now wearing something that constricts those vessels at the leg. So if from my explanation already, you can see that you're actually doing yourself a disservice. Some women, after a particular age, they start saying they call it bunion on close to the big toe. And then they see that they can't even wear some kind of shapes of shoes again, or it starts hurting them. So there's nothing like wearing something you're comfortable with. I am in support of looking good. Wearing heels make a woman look a particular way. You walk in a particular way, people get to notice you and stuff like that. But if you want to wear heels, you can get a flat slippers or something alongside, so that you wear it for some time, your leg is telling you it's tired, you change to something that is more comfortable. The problem is some women have gotten to a stage where they don't even hear the discomfort again. It's now part of them.
Well, I also want you to talk about tight girdles, but because you have mentioned people developing stuff on their legs, and Dr. Ajuan is an endocrinologist, he has to tell us what will be the effects for those people who have some metabolic disease and then some parts are so tight to the level Dr. Fumi said they cannot even feel, that means it's numb. What will be the...
In fact, one of the foot care education we give to diabetics is, please be careful of high heels, because there is a peculiar joint problem that they develop. That if you have diabetes and you are also used to wearing high heels,
that's besides the pressure.
Besides the pressure, so they can also damage the joint. So we say, look, be careful with high heels. And high heels, you are more likely to fall than if you do not wear high heels. Either on the staircase you sleep, or even where there is no staircase, and you are healthy before you left your house. You have a fall. Maybe before you left your room you are fine, but you skipped on the staircase and you end up in the hospital. And we are saying health. So there are diseases that will say, look, please, because you have diabetes, don't wear this. And a middle of the road is what doctor just gave us. Even if you have to wear it to take pictures, as soon as you finish your own pictures, go and change to a more comfortable shoe.
Right. Yeah.
Okay, and also, sir, there's also, I just thought of athlete foot.
Yes.
Because sometimes, apart from wearing those shoes, how well do you take care of your shoes? How well do you take care of your toes?
Okay, we have a call. Hello? Hello, you are on to...
Hello, good day. How are you?
I'm fine, you are on to Africa Health
Thank
on
you very
TSTV.
Yeah, thank you very much.
Sorry, we're not hearing you very well. Can you move a little? Who is speaking? I'm from where?
Can you hear me now?
Yes, I can hear you now. Thank you.
Okay, thank you very much. I'm calling from Maiduguri.
Okay.
Yeah.
Yes, what's your
Actually,
question? Yes, sir.
There is this spray that were used on the prefuels to desensitize, commonly used by men. I want to ask for if it has any adverse side effects.
Okay.
Utilization.
Yes.
Thank you very much.
Thank you very much. You didn't tell us your name.
Yeah.
Okay.
Okay. I'm Dr. Sheikh.
Okay. Thank you, sir.
Thank you very much.
Yeah.
Yeah.
Thank you. Is it Dr. Sheikh? He asked, some men use certain things to desensitize themselves. Because if the man is desensitized during the course of sex, he's not likely to reach the point of orgasm. And so he lasts longer. How safe are those things? Those are the questions that Dr. Ashek is asking.
Well, I guess we are saying the same thing.
Yes.
Your wife will be happier if you can also wait for her,
Yes.
so that you don't finish on time.
Yeah.
Yes.
So it is a nice thing to say wait for your wife, last a little longer.
Yeah.
But what is it that you are spraying? What is that thing that you are using?
Yeah, some actually pass through maybe FDA approval.
Yeah.
They are either inert, they're not likely to affect anybody, but just to desensitize the surface of the skin.
So again, we say, as I said, I know how my wife feels when I behave well. So there is, if there is something that I can use that will not endanger my own life
Or hers.
or hers.
Yes.
Because again, we've had stories of people that have lasted too long.
Yes.
They ended up in the hospital
Yes.
because their manhood refused to go down.
Okay.
Some women have also been injured because of a man that would last too long.
Yes.
So, if it is a safe, because I've not experienced anyone, but if I see anyone,
No, they are
I will
sold.
check.
They are sold in the market.
I will look for one and see what is inside.
Yeah.
But as long as it will not cause too much, you
Yeah.
will not last for too long
yeah.
to now endanger your own heart. And I think you should also be confide in your doctor.
Yes.
Let him say your heart is okay, you can go.
Yeah.
And then maybe he will tell you, try the first day and let's see in 2 weeks. So I think I will not say no
Yes.
if I know that you shouldn't use such a thing,
Yes.
provided your heart is good.
Yes.
But again, many of us, because we are not sick,
Yes.
you may not know that your heart is not good. It's not good enough as you think.
Yeah.
So please check with your doctor.
So the problem is multiple. It should be safe substance for you and safe for your wife. How it will make you last longer should be safe for you. This is like a joke, but it is the truth that whenever a man reaches orgasm, it's like and releases.
Yeah.
It's like he is as tired as someone who has run 9 miles.
Yes.
So, but if you are old and you now be running 18 miles, that may be trouble for you.
Yeah, for the heart.
Yes. Do you have a last thing to say on your...
Shoes.
Yeah, there's also girdle. You are supposed to talk about girdle.
girdles.
Yes.
Okay, I was talking about the shoes for athlete foot. Like when you bring your shoes home, they're cover shoes, your job necessitates you wearing cover shoe all the time. You should air those shoes. You shouldn't just keep them in a room that,
Okay.
so just to keep them healthy, because sometimes you start having that white in between the toes, and then it has a smell.
Okay.
And then maybe the stockings you're also wearing, washing it and all that. Those are like personal hygiene also
good
coming
habits,
into it.
okay.
Yeah. Now for tight girdles, I've heard people say it's better to wear it after you've given birth, not
Yeah.
before you've given birth. There are different theories about the story.
Okay.
But the problem I think I have with it is the fact that the tightness of you are not breathing well, you are not eating well,
Okay.
and then sometimes they say it does a bit of waist training, so that the more you wear it, it shrinks does it flatten out the adipose tissue on the stomach, and then it becomes, before you know it, your tummy now remains like that.
Yeah.
There are different theories to it, but my concerns are what is compressing on, what it is trying to push in, how uncomfortable you feel.
Yeah.
Yeah. So if there are people that use it to do exercises, you wear it for a particular number of hours,
Yeah.
you take a run in the morning,
Yeah.
you come back home, you're about to go to work or do other things, you take it off. I think that is better and is safer. But you should be consistent. There are other things you can add into trying to lose weight, other than just wearing a gidule and expecting it to force certain things to take shape and all that. So I think
Okay.
that's a safe way to
Well, I think the girdle also would not make you make your stomach go back after delivery. It's the exercise and maybe diet would do, but maybe for that moment, it's. On this note, I think we will have to call today a full day, and thank you very much for viewing, and we expect your fuller participation. Tomorrow we will be on air by 6 o'clock to discuss further things that are very, very interesting in habits. Thank you very much, Dr. Fumi Olusoji.
Thank you so
We are grateful for your appearance in this program. Thank you very much, Dr. Ajon.
Thank you.
Thank you very much for coming.
I'm grateful.
And we are grateful to the media crew. This is Clear on Health, on Africa Health. We will be with you tomorrow. For now, goodbye.